If there is one exam which is the most important exam in terms of matching into the residency program of your choice or in the location of your choice, then it's this exam, which is the MSRA exam. Hi guys, my name is Monisha. Welcome back to my channel, and I matched into core psychiatry training here within London, and this is how I did it. One of the key things in terms of matching not just to psychiatry but into a lot of other specialities and also in the trust, university or location of your choice, then it's to top or get really good scores in this exam. In today's video, I'm going to talk about what exactly is MSRA exam, how to prepare for it, what are the resources that you need to look into, when can you apply, how can you apply, and other bits about the exam that you need to be aware of, including revision tips and also tips from people who have recently sat the exam and matched into residency program here within London. Before we get on to the video, I just wanted to thank you guys for following my channel and for supporting my page. And we've recently crossed 40,000 subscribers, which is a really tiny milestone but means the world to me. So thank you so much for supporting this channel. I was looking at the statistics recently, and 80% of you guys who watch my videos haven't yet subscribed. So here's a tiny reminder: if you could subscribe to my channel, it would mean the world to me. Alright, so right off the bat, what exactly is MSRA exam? So MSRA stands for Multi-Speciality Recruitment Assessment, which is a computer-based exam, and it's used as a way to enter a specialty training program in lots of different specialties. I'm going to list the whole list over here on the screen. So I'm just going to read a few of them, which is emergency medicine, anesthetics, core surgical training, core psychiatry training, clinical radiology, general practice, which is GP, neurosurgery, obs and gynae, ophthalmology, community, sexual and reproductive health, nuclear medicine. So in the last 1 year, a lot of the specialities have opted in for MSRA to be the judgment exam in terms of people being offered core training spots, and a lot of the specialities have fully switched to this, and they're no longer portfolio interview bits as well. So when exactly can you sit for MSRA exam? So in terms of applying for MSRA exam, you would apply for it when you're towards the end of your foundation training or your clinical fellow years, or you've done 2 years post your MBBS, which are equivalent to foundation training, and you're looking into applying for training within these specialties which I've just mentioned a couple of minutes back. So it's a pretty big deal to score really high in this exam, because it's not just the specialty of your choice that you get offered, but it's also the location of your choice that you get offered. You cannot directly apply for the exam. You would be applying for the application to the specialty of your choice on a website called Oriel. In terms of anything to do with training or application for training, whether it's core training or higher training or specialty training, your website, which is your go-to website, is Oriel website. So the first thing that you would do on it is to apply for the specialty of your choice. Like I strictly just applied for psychiatry because psychiatry has been my ride or die. But you can apply to various different specialties, but you'll have to look into what their criteria are and what their process is. Every specialty is different, every pathway is different. What works in psychiatry might not work in other specialties because everybody has a different timeline and different process. So you go on Oriel, you apply for the specialty of your choice. If your application is accepted, then they send you a link to book MSRA exam. You cannot directly go and book MSRA exam. Your application needs to get accepted for that. MSRA exam, again, not be sat whenever you want. It happens twice in a year, because there are 2 times in a year when you would start training. Either you're an August intake or you're going to be February intake. Currently, you cannot apply for August 2023 intake because, like I said, exam happens a couple of months before starting your training. So for August, it must have happened earlier this year. The application window would have opened, then you would have applied for the application to then get accepted, to then be sent the link for MSRA exam, to then have sat the MSRA exam, to then get your shortlisting. So August 2023 window has closed. However, the earliest you can sit for this exam is for February 2024 intake. The application window is going to open in the next coming months. They'll put an advert on Oriel, so that's your place to go to, like I said, to look for any kind of adverts in terms of entering training program. Alright, moving on to the duration of the exam. So the exam duration in total is for 170 minutes, that is for 2 hours and 50 minutes, and there are 2 sections within the exam, which brings me to the pattern of the exam. The number 1 is the situational judgment test. That's what they have been infamously called, or the professional dilemma questions. The second section is the clinical solving paper. So the professional dilemma, or also called as the infamous situational judgment test or the SJTs, is the section that you would be attempting first. You cannot choose which comes first. That's how it works. And then you would be doing your clinical problem solving paper. So the PDs, or the professional dilemmas, consist of 50 questions, and you're given 95 minutes to complete this test. Mind you, not all 50 questions are your exam questions. Only 42 of these questions are your exam questions, and 8 of these are pilot questions. And what that means is that these are just questions that they're testing to see if they want to introduce them in the future exams or not. not. You wouldn't know which are these 8 questions. So you will have to wholeheartedly, give your everything and 100% to all 50 questions. You wouldn't know which are the 42 questions whose marks are going to count towards your final score, and which are the 8 ones which are just test questions or pilot questions. The second section after you've sat your SJTs would be a clinical solving paper, which consists of 97 questions, and there's 75 minutes to complete the test. Again, only 86 of these 97 questions count towards your final score for clinical solving paper, and 11 of these questions are pilot questions, which are again just test questions or questions that they are just testing waters for to see how people attempt these questions, or if these questions are valid questions that are going to be introduced in future papers or not. Again, you wouldn't know which are these 11 questions, so you will have to give your 100% to all of the 97 questions. So like I said, you would have 75 minutes to sit them, which would mean you have somewhere around 75 seconds, over a bit more than that, per question. Now in detail about the exam and the exam pattern. So first off is the SJTs, which is the situational judgment test or the professional dilemma. What they basically test how capable you are or how well you can adapt to challenging or difficult situations, and these are not just ethical scenarios. These could be things like professionalism or sensitivity, empathy, confidentiality, and how well you cope under pressure. So there are 3 domains under which they would be testing you. Number 1 is professional integrity, second is coping with pressure, and the third is empathy and sensitivity. The questions are not just based off ward case scenarios, they could be based off GP placements, out of hours, on calls, so anything and everything that a junior doctor is going to face while working within the NHS. The pattern of questions for professional dilemma is again divided into 2 sections. So the part 1 is ranking questions that are given, and the part 2 is multiple choice. What exactly is ranking question is that you would be given a question and you would be given 5 options. You need to rank them from most probability to least probability in terms of what you would be doing. Say there was a difficult, challenging situation and you're presented with 5 options. What is most likely that you're going to do and what's the least likely that you're going to do, and in between putting them in the same order. If you get the order exactly right as what is the right order, then you get granted 20 out of 20 marks for that one question. And depending on how close and how far you are to the original order or what is the right order, you're granted marks anywhere from between 8 marks to 18 marks. The second pattern of questions that you're given are multiple choice, and what happens within that is that you're given a question, there are 8 plausible options given over there, and you need to choose your best 3. If you get all 3 right, then you're granted 12 marks. If you pick 2 right options, then you're given 8 marks, and if you get 1 right, then you're given 4 marks, and obviously if you get none of them right, then you're given 0. In my personal opinion, the situational judgment test is the deciding factor in terms of what your ranking is going to be, because clinical questions have been preparing for it since your first year of MBBS. Situational judgment test is the place which I would say international medical graduates struggle, including myself, and that's because we are not inclined towards thinking a certain way, having not worked in the NHS or having not done our foundation training here or not worked in every scenario or every specialty within the UK or not having done our medical school here in the UK. People who have done their medical school over here are sort of experienced in SJTs because they have been sitting for similar pattern of questions within their medical school, post their medical school, in foundation training, etc. So I would say do not overlook situational judgment tests. It sounds very simple when you hear about it, look at the questions, but trust me, they are quite key in terms of your all UK ranking. Practice as many as possible because that will give you a bit of a taste as to what sort of questions can come, because a lot of the options are pretty similar, and what might seem that, oh, this is personally I think would be the right thing to do, is very different to what ethically and professionally they expect out of you. Moving on to clinical solving papers. So clinical solving paper tests your clinical skills and your medical knowledge, something that you've been appearing for since your first year of MBBS. There are 12 different clinical topics or subjects that they test you on. That is cardiovascular, dermatology, ENT, ophthalmology, endocrinology, metabolic syndromes, GIT, nutrition, infectious diseases, hematology, immunology, musculoskeletal, allergies, genetics, pediatrics, pharmacology, psychiatry, neurology, renal, urology, reproductive, and respiratory. Okay, so these are all the subjects from which the clinical solving questions come from. Again, they test you under 5 domains. These are the different domains there would be questions from. So number 1 would be investigation, in terms of specific investigations that you would carry out to come to a diagnosis. The second domain is diagnosis, how well you can identify the condition that they have listed within the question and the options and things like that. Third is emergency, so potential serious illness or serious emergency and the right kind of intervention for it. Number 4 is prescribing, what's first line, what's second line, what are NICE guidelines, what are the protocols, what's the guidance, etc. Number 5 is management, non-prescribing. You also need to be aware of the non-pharmacological treatment options, non-pharmacological management options, which are also within NICE guidelines as well. So these are the 5 domains they would be testing you on. In terms of the clinical solving questions, there's 2 patterns to it again. The first one is extended matching question and the second one is single best answer. So the EMQs, the extended matching questions, you are given 7 to 10 plausible options for it. So basically there will be a question, a clinical scenario, could be for diagnosis or investigation or management or for prescribing, and you would be given 8 to 10 options and you need to choose the right possible option. The thing to be aware of is that these options are pretty similar and very close to each other, and you will have multiple consecutive questions with same exact options, which is tiny bit tweaked within the question. So make sure that you've practiced enough because they are very similar and very close in terms of the options and in terms of the questions. Single best answer is the other pattern of questions that come, which is pretty much straightforward, to be honest. There'll be one best possible answer for the question that is given to you. There is no negative marking for this exam, so I would say attempt all questions, do not skip any questions, don't overlook any questions. In terms of the cost of the exam is for free, which is great. Probably the only exam within the NHS, within your training or non-training part of your life here in the UK as a medic, that you would be sitting for free. Having said that, don't take it lightly because it decides if you're going to get your specialty and the location of your choice or not. Now moving on to the most important thing that I get asked a lot is question banks. I have talked to people who recently sat their MSRA exams, who've mashed into training programs within UK, especially in London, Oxford and Cambridge. This is what they've recommended, and there's also bits and pieces from my own personal experience when I sat for MSRA exam. So there's lots of different question banks out there and you will see lots of options being mentioned by lots of people. My recommendation always is to do as many questions as possible. So the first one that you must have heard a lot about is eMedica. This question bank was the first question bank that I did when I was preparing for MSRA exams. It has around 1400 clinical scenario questions and around 120 situational judgment tests. I went through this question bank pretty quickly. This sort of became my base before I moved on to another question bank. Explanations weren't very long, so that was what I felt personally was the drawback. Moving on to past medicine. So past medicine, I honestly think is great. It's got 2500 clinical scenario questions and around 250 situational judgment tests. It is the cheapest of all the question banks. The great thing about it is that the explanations are quite lengthy and in detail. They also have linked to NICE guidelines as well, which is freaking great. Also links to YouTube videos which have audio visual theory, which also helps you to retain a lot of the information. The drawback of this question bank was that on the day of the exam I realized questions weren't pretty similar. There were lots of different questions which I did not come across in these 2 question banks which were there. Which brings me to the third question bank, which is the MCQ bank. Questions have come pretty much similar from this question bank, the exam, but having said that, it's not that 100% they are similar, but they're pretty similar. A lot of the questions are quite word to word as well, is what people who have recently sat the exam have told. There's around 1000 questions which are clinical scenario questions and 200 situational judgment tests. So as you can tell, it's not many. The upside of it, like I said, is that it's the closest to the real exam, but the downside is that the explanations are limited and also the number of questions are limited. On top of using any of these question banks, whichever you want to choose, it's up to you. I would highly recommend going through NICE guidelines. If you ever stumble upon a question where you feel stuck or you feel like the answer is not right because you feel like you're practicing differently at work and the question bank is recommending you to do something else, please fall back on NICE guidelines. They are your holy Bible. They are your go-to. You need to follow NICE guidelines. They need to be held to the highest regard and not your question bank. If your question bank tells you something, if it's possibly not the right answer, please fall back on NICE guidelines. I cannot stress about this enough. I know I'm repeating myself, but please on the day of the exam, if there's a question, they are not going to follow MCQ bank, they're going to follow NICE guidelines, and if you have answered your question based off NICE guidelines, then you are going to score the right point. So NICE guideline overrules any of these question banks. Alright, so moving on to revision tips. In terms of revision tips, I would say practice. Nothing will help you more on the day of the exam than practicing as many question banks and as many questions as possible. You might read all the theory, but unless you've practiced and timed yourself, timed practice is what is very important. And I think the best way to prepare for these exams, and I learned it very late in my career and life, is to make flashcards. You can use physical flashcards. You can literally order them off Amazon. They don't cost very much. I can leave a link down below. That's what I ordered off Amazon and I've used them ever since, and they've lasted me for multiple exams. You can make physical flashcards if that's what works best for you, or you can also make e-flashcards or electronic flashcards. So I used a mix of both. When I felt like I wasn't able to concentrate on my laptop, I would make physical flashcards, or when I was commuting to work, I would be on my phone and just flip through these flashcards on this app called 𝐂𝐚𝐦𝐞𝐫𝐚 app, which is absolutely great. It's a free app. Please download it, use it. You can use it on your desktop as well. You can use it on your phone as well. On my way to work, 40 minutes commute, best way to utilize my time. I would also use those flashcards. So highly recommend using that. And they use an evidence-based technique called spaced repetition. What I mean by that is if you get a flashcard wrong or anything to do with that topic wrong, most likely that they're going to show you those flashcards again and again, so you don't have to, like, in your head separate flashcards and see, oh, maybe I need to revise this more than the other one. They will make you revise the ones you're getting wrong a lot more. By they, I mean the app, 𝐂𝐚𝐽𝐻 app. Also, the other thing that I would say in terms of the duration that you require to prepare for this exam depends on your personal circumstances and your situation. If you're currently working, I would say a couple of months. Highly recommend that, because you want to make sure that you do really well in the exam, and the competition rates have only gone up. If you want it in a specific place of your choice, then I would say give yourself enough time to prepare for the exam. If you think that you're currently taking time out, or you're taking a career break or a career gap, then don't require that much time. Again, it all depends on your grasping skills and how confident you feel. If you feel like you require more time, by all means take more time, but what I'm saying is that the minimum amount of time that I would recommend is at least a couple of months, because you want to get into the specialty of your choice in the place of your choice, and you don't want to mess that up. So this brings me to the end. Hope you found this video helpful and useful. If you did, then you know the drill. Please do give it a big thumbs up. If you have any other specific questions with regards to MSRA exam, then drop it down below in the comment section and I will answer them to the best of my capabilities. And I hope you're looking after yourself and your loved ones, and I'll see you in the next video. Bye.